What's the best under-eye filler?
People often ask about the best filler for the under-eye area to treat hollowness, eye bags, discoloration, and even wrinkles. The answer to this question is predicated on the assumption that filler is appropriate in all of these conditions. I'll discuss how I respond to this question about the best under-eye filler in my practice. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. As a specialist in cosmetic eyelid surgery, I'm known for helping people with issues like hooded eyes, drooping eyelids, and under-eye bags. I also perform a lot of non-surgical procedures, such as fillers under the eyes for hollowness and to camouflage slight to moderately prominent under-eye bags. I also use fillers under the eyes in combination with treatments like platelet-rich plasma, or PRP, to help people with hollowness, discoloration, and skin wrinkling. So when people ask me, which under-eye filler gives the best results? The answer is not a specific brand. More than one brand of filler can be used to enhance a hollow area under the eyes. It's important to understand that a brand of filler doesn't prevent issues like overfilling or underfilling, nor can it prevent rare but dangerous complications like vascular occlusion, where the filler is injected into an artery, resulting in tissue loss or even blindness. The results of filler treatment and the minimizing risk of complications is actually in the hands of the doctor performing the procedure. Taking a step back, it's the doctor's judgment that determines if an under-eye filler should be used even at all. The indication for using fillers under the eyes is to treat hollowness and to camouflage puffy bags, which are minimally prominent. Under-eye hollowness is often due to a deficiency in bone projection and volume. In my opinion, hyaluronic acid fillers are ideal for this area. Fillers can be placed in an area called the tear trough. Enhancing the tear trough can help improve the appearance of hollow areas as well as the transition zone or the transition area adjacent to under-eye bags. Now, some practitioners who don't perform surgery will try to use filler to treat all cases of eye bags. Unfortunately, when the under-eye bags are too prominent, fillers can actually make under-eye bags look even more puffy and even more prominent. The type of filler material does matter when it comes to safety. My preferred material for patient safety and for predictable results is hyaluronic acid. Hyaluronic acid is a naturally occurring substance in the body found in the skin and the joints. This means that this material is generally well tolerated without any kind of foreign body reaction. The hyaluronic acid fillers I use are in the Restylane and Juvederm line of products. Many people want longer-term benefits, so they look to have permanent or semi-permanent fillers. I strongly discourage this choice. Unlike hyaluronic acid fillers, permanent and semi-permanent fillers actually require surgery for removal should there be a problem. Hyaluronic acid fillers, on the other hand, can be dissolved with the injectable enzyme hyaluronidase. I also don't recommend fat grafting for this area. In spite of the best of intentions, fat grafting is unpredictable and can result in lumps and irregularities which actually may be too difficult to remove without compromising eyelid support. Further, as an oculoplastic surgeon, I can't overstate the importance of safety around the eyes. There have been incidents of vascular occlusion resulting in blindness after filler injection in this area. As far as short-term risk is concerned, bruising is probably the most common issue after under-eye filler injection. I have a lot of experience with reconstructive surgery, such as fracture repair and the placement of cosmetic implants like tear trough implants. I use this experience to help me place fillers using blunt-tipped cannulas in this area, thereby avoiding any bruising in the majority of my patients. Many of our patients actually schedule for filler procedures such as under-eye or tear trough filler placement through our same-day scheduling system. This means that they come during a break in their workday, such as lunch, to have a procedure and then go right back to work. I see patients typically after 2 weeks to see how the material has settled and if any enhancement would be appropriate. So when considering under-eye filler treatment, the importance of safety, as I said earlier, can't be overstated. An experienced physician who is prepared to address any complication in a timely manner is, in my opinion, the best option when risk is factored into your decision. Marketing influences consumers to choose product, when in actuality, the practitioner choice you make is far more important. I hope you found this information helpful, and thank you for your question.